It sounds like your doctor has diagnosed you with nerve root irritation. This can happen when muscles, ligaments, or joints press on or irritate the nerves. While that sensation can feel sharp or radiating, most cases naturally improve within 6 to 12 weeks. Healing begins with gentle movement, not forcing, but guiding your body. A stretch like child's pose encourages awareness in how your spine moves. If symptoms worsen, pause. Progress should feel safe, not painful. For a speedy recovery, avoid heavy lifting. If needed, bend your knees and straighten your back. Your physical therapist will guide movements tailored to you to build strength and confidence around your spine. Medications can support healing. Non-steroidal anti-inflammatory drugs such as Advil and Mobic help reduce inflammation, and in stronger flare-ups, a short steroid course such as Medrol dose pack may calm things quickly. Always take these with food and monitor for stomach discomfort. Acupuncture can help by easing nerve tension and triggering the body's natural healing signals. If progress is slow, your specialist may order an MRI to pinpoint the irritation. Sometimes a targeted epidural injection delivers medication right to the inflamed nerve for focused relief. However, if you notice sudden leg weakness, trouble controlling urination, seek emergency care immediately. Consistent guided practice helps healing. Each stretch rebuilds trust in your body. You're not alone. With patience and support, your body can return to ease and strength.